block. Fascicular blocks are conduction problems in distal part of L left bundle branch. Fascicular block or conduction problems in the distal part of left bundle branch block. In today's lecture, it is worth it to consider. In today's lecture, it is worth it to consider in a little more detail anatomy of the branches of the bundle of the haze. Anatomy of the branches of the bundle haze is very important to know the concept of fascicular block. For this reason, first of all, we are discussing to you anatomy of the bundle of haze, left bundle branch, right bundle branch, and later on discuss one by one different type of the fascicular blocks. Now, for example, this is the AV node, and this is the haze bundle. This is the haze bundle. This is left bundle branch. This is right bundle branch. This is anterior fascicle, and this is posterior fascicle. So, to know the concept of the fascicular block, it is very important to know first of all about the anatomy of the branches of the bundle of the haze. First of all, AV nodal block. This is AV nodal. This is AV nodal. After AV nodal, this is haze bundle. Good. Haze bundle. This is left bundle branch. This is anterior fascicle. F-A-S-I, fascicle. This is posterior fascicle. And this is right bundle branch. So to know more the concept of fascicular block, it is very important to know anatomy of the branches of the bundle of the haze. Now, bundle of the haze, first of all, are divided into two fascicles. One is anterior fascicle, another is posterior fascicle, and right bundle branch has no any divisions. This was the anatomy of the bundle of the haze and its branches, which is very essential to know the exact definition of the fascicular block and the ECG change which is occurred in patient who is having fascicular block. After the anatomy of the bundle of the branch, after the anatomy of the haze bundle branch, now to know more the concept of the fascicular block, three basic principles of the ECG is very important to know the concept of the fascicular block. These three basic principles, which is very important to know the concept of fascicular block, we are explaining now. These basic principles, three basic principles to know more the concept of the fascicular block. Principle number one. Both ventricles are depolarized by three pathways. Both ventricles both ventricles depolarized by three pathways. These three pathways: anterior fascicle, posterior fascicle, and right bundle branch. For example, again I'll give you the example. These three pathways: one is right bundle branch, another is left bundle branch, and anterior fascicle. Sometimes this three pathway, one is right bundle branch, and posterior fascicle and anterior fascicle. These three pathways are depolarized both ventricles. Which pathways? Anterior fascicle, posterior fascicle, and right bundle branch lead to depolarization of the both ventricle. This is the first principle when you want to learn more about the fascicular block. Now, principle number 2. Cardiac access. Later on we discuss about the cardiac access. What is the cardiac access? Because it is very important. One of the part of description of the ECG is quite related to the cardiac access. Now, just in a short, I am telling to you something about the cardiac access. Cardiac access depends. Cardiac access depends on the average direction of the wave of ventricular depolarization, which is seen from front, which is seen from front. This was principle number 2.
So that is
principle number 2.
of the waves.
Cardiac access depends on the average direction of the wave of ventricular depolarization, which is seen from the front. Later on we will discuss to you, and I am explaining to you about the cardiac access. Now we should learn it with the fascicular block is quite related to know the exact concept of the left axis division. Number 2.
From front is special.
From front. Number 3, which is seen from front. Number 3, as I mentioned before so many times, left ventricle. Left ventricle contains more muscle. So therefore it influences more on axis. Again, I am repeating to you, fascicular block, the basic principle which is required to know the concept of the fascicular block. 3 things is very important. Number 1, both ventricles depolarized by 3 pathways: anterior fascicle, posterior fascicle, and right bundle branch. Principle number 1, to know the concept of the fascicular block, 3 important things is very important. One is both ventricles depolarized by 3 principle: anterior fascicle, posterior fascicle. Later on I am discussing and I am telling to you the anatomy of the branches of the bundle of the hairs. Anatomy of the branches of the hairs. Number second concept, cardiac access. This is also give a definition of the cardiac access to you. Cardiac access depends on the average wave of depolarization. The cardiac access depends on the average direction of the wave of depolarization of the both ventricle. This is principle number 2. Later on we'll discuss to you about the cardiac access. What is the cardiac access? What is the clinical role of the cardiac access? Now, just now I am telling them the name of the cardiac access. Later on we'll discuss to you. And the last principle, which is very important, as I mentioned so many times, left ventricle contains more muscle, so that, or therefore, it has more influence on cardiac access. It has more influence on the ECG than the right ventricle. Now these was 3 principles that I am discussing with you, and later on we will step by step explaining the fascicular blocks. Fascicular blocks. To know more the concept of the fascicular block, it is very important to drawing a simple diagram of the heart. Simple diagram of the heart. Again we are coming to the anatomy of the wiring diagram of the heart. Dense fiber tissue, fibrous annulus. Right atrium, left atrium, right ventricle, and left ventricle. SA node and AV node. This was AV node. This was AV node. This was bundle of hairs. This was bundle of hairs. And this was left bundle branch, right bundle branch, hairs, left bundle branch, anterior fascicle, and posterior fascicle, and right bundle branch. Now, first of all, we are discussing about the anterior fascicular block. If this part of left bundle branch, which is called anterior fascicle, if it is blocked, what is really happen? What would be the cause? What would be the ECG pattern? Now we'll discuss to you about the anterior fascicular block. Anterior fascicular block. You anterior fascicular block. Now, this fascicle is having a block. Now, if the anterior fascicle block is occurring, what is really happen? If this part of the left bundle branch is blocked, the wave of depolarization should be go through the posterior fascicle, and the left ventricle has to be depolarized by posterior fascicle, and the axis is rotating upward. The axis is rotating upward. Axis meaning is depolarization wave, or cardiac vector. Cardiac vector or wave of depolarization go through the left, the posterior fascicles, and this wave of depolarization through the posterior fascicle is rotating upward. So in the cases of anterior fascicular block, what you will see? In the posterior fascicular block, lead to left, anterior left anterior hemi block. Blockage of left anterior fascicle is called left anterior hemi block. Anterior fascicle block led to left anterior hemi block. Left anterior hemi block led to left axis division. Left axis division. Left axis division. Left axis division. ECG key point of the patient who is having left anterior fascicle, which is lead to left anterior hemi block. What would be the ECG or the key point of patient who is having left anterior fascicular block? Number 1. This patient is having left axis division. Left axis division. ECG feature of the left axis division. Positive QRS complex. Positive QRS complex. And lead in lead 1. In lead 1 the QRS complex is positive. And QRS complex negative in lead 2 and 3. Good. This was the key point of patient who is having anterior fascicular block. Anterior fascicular block lead to left anterior hemi block. Or left anterior hemi block is the commonest cause of left axis division. The most common cause of left axis division is left anterior hemi block. In the ECG, what type of the ECG pattern will produce left anterior hemi block? Left axis division. What would be the ECG pattern of patient who is having left anterior hemi block, which lead to left axis division? In left axis division, you will having positive QRS complex in lead 1 and negative QRS complex in lead 2 and 3, and the axis would be at the range of minus 40 degree. This is a 3 criteria in patient who is having left anterior fascicular block. Left anterior fascicular block, what type of axis will produce? Left axis. What is the most commonest cause of left axis division? Left anterior fascicular block. Causes of left anterior fascicular block. The most common causes of left anterior fascicular block is number 1, fibrosis. Fibrosis, number 1. Number 2, infarction. And this was the causes of left anterior fascicular block. Left anterior fascicular, the most 2 common causes of left anterior fascicular block is fibrosis and infarction. Particularly inferior wall infarction is the commonest cause of left axis division. Now, after cause, what is the clinical relevance of patient who is having anterior fascicular block? What is the clinical relevance? So, left anterior fascicular block, which lead to left axis division, clinically has no any grade value, and prognostically is not significant. Clinically and prognostically, left anterior fascicular block has no any significant, value. Now, this was about the anterior fascicular block. Again, I am repeating. Anterior fascicular block is called left anterior hemi block, which lead to left axis division. One of the most common causes of the left axis division is left anterior fascicular block. If patient is having left anterior fascicular block, the left ventricle has to be depolarized by posterior fascicles. So the axis is rotating upward. And the ECG we will see Criteria which is indication for the left axis division. Criteria of the ECG of patient who is having left anterior fascicular block and left hemianterior block is left axis division. Left axis division is having a positive QRS complex in lead 1 and negative QRS complex in lead 2 and 3. And the axis would be at the range of -40. Cause fibrosis and infarction. Treatment has no any clinical relevance, or there is no any great value in the treatment of, or have no any great value treatment of anterior fascicular block. This was about the anterior fascicular block. Now we are coming to the posterior fascicular block. Now we are coming to posterior fascicular block. Posterior fascicular block. Posterior fascicular block. Now, this time, anterior fascicle is not blocked. Anterior fascicle is not blocked. And this time, we are coming to the posterior fascicular block. This time, the block will occur in which part? Here is, for example. Now, this time the block is related to the posterior part of the left bundle branch, which is called posterior fascicle. And if there is a posterior fascicle block, unlike anterior or unlike anterior fascicular block, posterior fascicle block is extremely rare. Is extremely rare. 1 out of the 10,000. 1 out of the 10,000 of ECG, you will see a cases of the posterior fascicular block. It is extremely rare. If there is block is occurring, if there is a block, the axis may deviate toward the right side. Posterior fascicular block is extremely rare. If you will see in the ECG, you will see in every 10,000 patient who is having ECG, just 1 cases of posterior fascicular block you will see. If a patient is having posterior fascicular block, the wave of depolarization this time is coming toward the right bundle branch. If the posterior fascicle is blocked, the wave of depolarization should come through the right bundle branch block and lead to depolarization of the right ventricle. The axis can be deviated toward the right. So, if a person who is having posterior fascicular block, the key pattern of the ECG of this patient is having left, right axis division. ECG pattern. Opposite of anterior fascicular block. This patient is having positive, negative QRS complex in lead 1 and positive QRS complex and positive QRS complex in lead 2 and 3. Because when we are studying the axis, we should care about 3 leads. Lead 1 standard, lead 2 and lead 3. Later on we discuss detail about the cardiac axis. Again we are coming to the left posterior fascicular block. Left posterior fascicular block is called left posterior hemiblock. Left posterior fascicular block is called left posterior hemiblock. It is extremely rare. It is occurring 1 out of 10,000 of the ECG. If a patient is having this type of block, the axis can be directed toward the right, and the ECG we will see right axis division. Negative QRS complex in lead 1 and positive QRS complex in lead 2 and 3. Before we make a diagnosis of left posterior hemiblock or left axis division, it is very important to exclude particularly other causes of the right axis division. right ventricular hypertrophy should be excluded. WPW syndrome should be excluded. Dextrocardia should be excluded. And anterolateral wall infarction should be excluded. Then you will make it a diagnosis of the left posterior hemiblock. Left posterior hemiblock is due to posterior fascicular block. If this fascicle is blocked, the axis should be rotated toward the right, and the right ventricle should be depolarized by the right bundle branch. This was mechanism of the posterior fascicular block. After the fascicular block, we are coming to the next type of the fascicular block. Now this time this patient is having anterior fascicular block as well as posterior fascicular block What will be the ECG pattern of patient who is having anterior fascicular block as well as posterior fascicular block? Now, as we know, this anterior fascicular block and posterior fascicular block, or these two fascicles, quite related to the left bundle branch. Blockage of anterior fascicular block and posterior fascicular block is equivalent. Is equivalent of left bundle branch block. If anterior fascicular block as well as posterior fascicular block is equivalent of left bundle branch block. Left bundle branch block. We have already discussed anterior fascicular block. After the anterior fascicular block, we discussed with you posterior fascicular block. Left anterior fascicular block is called left anterior hemiblock. Posterior fascicular block is called left posterior hemiblock. Anterior fascicular block led to left axis division. Posterior fascicular block led to right axis division. Now, if these two branches of the left bundle branch block, anterior fascicle and posterior fascicle is blocked, now what will happen? When these two branches is blocked, it would be equal. It would be equal to left bundle branch. It would be equal to left bundle branch. Now, this is why we are discussing three left bundle branch block already. So, anterior fascicular block and posterior fascicular block is equivalent of the left bundle branch block. After these two type of the anterior fascicular block and posterior fascicular block, we are coming to the next type of the block. Next type of the block. Next type of the block. This time, if there is combination of the anterior fascicular block, combination of the anterior fascicular block plus right bundle branch block, right bundle branch block. Now, anterior fascicular block plus right bundle branch block is called bifascicular block. It's called bifascicular block. Anterior fascicular block plus right bundle branch block is called bifascicular block. Anterior fascicular block plus right bundle branch block is called bifascicular block. what would be the ECG of patient who is having bifascicular block? Bifascicular block ECG pattern. Bifascicular block ECG pattern. Bifascicular block ECG pattern. Now, anterior fascicular block, what type of the ECG change will produce? Left axis deviation. So now the key point of the ECG of the bifascicular block. Left axis division, left axis division, left axis division plus right bundle branch block in V1. In V1 we have got this type of the pattern. In V1 we have got this type of the pattern. W shape. This is number 1 criteria, left axis division. Number 2, right bundle branch block, and the axis would be minus 60 degree. Those patient who is having anterior fascicular block as well as right bundle branch block, we call it fascicular block, bifascicular block. Bifascicular block ECG pattern. If you will see the ECG of this patient, if they have got right bundle branch block plus left axis division, right bundle branch block plus right axis division, is called bifascicular block. Bifascicular block. What is the clinical role of the bifascicular block? Sometimes bifascicular block associated with syncope, or if bifascicular block associated with a syncopal episode, this patient immediately requires for permanent pacing. If the patient does not produce any symptom, they do not require any pacing. Or if a patient who is having anterior fascicular block plus right bundle branch block and they become symptomatic, it is very important to immediately consult with cardiologist, or we refer the patient to cardiologist. Now, this was about the bifascicular block. This was about bifascicular block. Now we are coming to the next type of the block, fascicular block. What would be another type of the fascicular block? What would be? Trifascicular block. Trifascicular block. Trifascicular block means if the patient is having anterior fascicular block, anterior fascicular block and right bundle branch block, when it is associated with first degree AV nodal block, it is called trifascicular block. Anterior fascicular block plus right bundle branch block in association with the first degree AV nodal block, which is shown in the ECG, on the ECG by prolongation of the first degree AV nodal block by the prolongation of the PR interval. This is called trifascicular block. Key point of the ECG, key point of the trifascicular block, trifascicular block, trifascicular block. Trifascicular block. The patient is having anterior fascicular block led to left axis division. ECG, left axis division, and right bundle branch block number 2, RBB, RSR prime, number 3, first degree AV nodal block, prolongation of the PR interval, prolongation of the PR interval, and axis would be at the range of minus 80 degree. This was about trifascicular block. Trifascicular block, combination of the bifascicular block. Combination of the bifascicular block with first degree AV nodal block is called trifascicular block. Clinical relevance. Those people who is having a bifascicular block or even trifascicular block, if they are asymptomatic, they do not require any treatment. If those people who is having a symptom of the block, for example, palpitation, chest pain, vertigo, dizziness, fainting, syncope, immediate consultation with cardiologist is needed. If a person who is not having symptom and sign of block and they are stable, there is no need to consult with cardiologist. If you are in a doubt or if you are in a worry from the risk of the clinical symptom and sign of the bundle branch block, it is very important to consult with cardiologist. Now, this was about trifascicular block. Now, the last part of the fascicular block. The last part of the fascicular block. The last part of the fascicular block. Last part of the fascicular block. If those people who is having anterior fascicular block and also they are having right bundle branch block, or in addition of the anterior fascicle and right bundle branch block, this patient is also having posterior fascicular block. It is equivalent of the complete heart block. It is equivalent of the complete heart block. Those patients who is having anterior fascicular block and posterior fascicular block and posterior fascicular block, it is equivalent of complete heart block, because anterior, posterior and right band, there is no any route to electrical impulse go through these routes and lead to ventricular depolarization. So this is similar to complete heart block. This was about the fascicular block. This was about the fascicular block. Anterior fascicle block has no any specific treatment. No prognostically is important. Posterior fascicle is also clinically is not important. Anterior fascicle and posterior fascicle. Combination of the anterior fascicle and posterior fascicle is equivalent of the left bundle branch block. If they are produce some symptom and sign, they require some treatment, otherwise there is no need. If a patient who is having anterior fascicular block plus right bundle branch block, they call it bifascicular block. Clinical role of bifascicular block is related to the symptom and sign. Those people who is having symptom and sign of block, they should need cheap pacing. If they do not have any symptom and sign of block, there is no need to treat this patient. And finally, combination of the anterior fascicular block and right bundle branch block and association with first degree AV nodal block is called trifascicular block. Trifascicular block. Trifascicular block is equivalent of complete heart block. This was about the fascicular blocks. I think it was a bit easy. They are having their own formula. Formula. Now, who is volunteer to tell me something about these blocks? Now I am repeating. Before discussing about the fascicular block, it is very important to know anatomy of the branches of the haze. Anatomy of the branches of the haze. Now, this is the AV node. This was the AV node. This was the haze bundle. This was left bundle. And this was anterior fascicle. Anterior fascicle. And this was posterior fascicle. And this was right bundle branch block. If you know the anatomy of these branches, it would be very easy to know the mechanism of the production of the fascicular block. In addition of the anatomy, there are three principles also very important to know the fascicular block. The first principle, left ventricle or both ventricle are depolarized by three pathways. Which pathway? Posterior fascicle, anterior fascicle, and right bundle branch. Depolarization of the ventricle is quite related to these three pathways. This is principle number 1. Principle number 2, cardiac access. Cardiac access depends on the average direction of the wave of depolarization of both ventricles. It means the wave of depolarization which lead to the direction of the wave of depolarization which lead to ventricular depolarization, it is called cardiac access. Later on we'll discuss it. Later on we discuss the cardiac access in detail. The three principle which is very important is left ventricle contain more muscle than the right ventricle. Therefore, it has more influence on the ECG, particularly on the access. This was about the anatomy. And another basic and principle of the fascicular block. Now anterior fascicular block. Anterior fascicular block. Afarin wadre. Anterior fascicular block. Anterior fascicular block. Anterior fascicular block. If there is a block of anterior fascicle, what will happen? Left axis division, and we call that left anterior hemi block. And the ECG left axis division. Left axis division criteria of the ECG: positive QRS complex in lead 1 and negative in lead 2, 3. This was about the anterior fascicular. Now we are coming to the posterior fascicular block. A patient who is having posterior fascicular block, the axis should be directed toward the right, and the ventricle depolarized by the right axis. So in the cases of the posterior fascicular block, you will have right axis division. Criteria of the ECG of patient who is having right axis division: negative QRS complex in lead 1 and positive in lead 2 and 3. And posterior fascicular block is called left posterior hemi block. Number 2, combination of the anterior fascicular block. Combination of anterior plus posterior fascicle is equivalent of the left bundle branch block. Now we are coming to combination of the anterior fascicular block to right bundle branch block is called bifascicular block. The key pattern of patient who is having right bundle branch block, left axis division as well as right bundle branch block, and the axis should be at the range of minus 60. Now combination of the bifascicular block with first degree AV nodal block is called trifascicular block. Clinical relevance: anterior fascicle block has no any value clinically, because they do not produce any symptoms. Another bifascicular block, if they produce symptom, they require treatment. Trifascicular block, if they produce any symptom and sign, they require treatment. Otherwise, there is no need to do some intervention. This was about the fascicular block. Now, I think it would be enough. It was a little tough, or it was easy. Escape rhythm. Tomorrow we will discuss to you the escape rhythm. Escape rhythm is also entered in the differential diagnosis of the block.